I consider the facelift my signature procedure, which means after 32 years of being a plastic surgeon, you sort of migrate into areas of surgery in which you produce what you think are the best results for your patients and for you. What I do after interviewing my patient in the morning of surgery is come into my private space, close the door, usually get a cup of coffee, glass of water, and spend a half an hour actually looking at my patient's photograph to hone in on the areas where I think improvement is to be achieved, which really determines what I will do in the operating room in a half an hour. So here we have a photograph of Barbara, and I'm looking here at her three-quarter view, and one could clearly see the ptosis or hanging of her cheek, which is seen right here, which we will lift in the vertical dimension and suture in the horizontal dimension in order to soften her jowl, ameliorate or soften her nasolabial fold, and create some horizontal fullness in her cheek, making her cheek look lifted. At the same time, we see in her neck she has platysmal bands, muscle bands right here, which are very typical. Nice thin skin. Be very easy to tighten the skin and tighten the muscle behind the ear so that we create a nice jawline and neckline. Let's give you another photograph. The profile demonstrates the same situation where we actually look at the nasolabial fold marionette line, wrinkling in the cheek, and the need to move the cheek fat superiorly along with tidy up the neckline. And here we have a down view of the neck demonstrating the fat in her neck was removed using some liposuction, and then redraping of the skin once the neck is contoured with the fat removal. And here's an excellent photograph of the platysmal or muscle bands, which will be tightened at the time of surgery. What that does is allow this procedure to appear very natural by using natural muscles already in the neck and recreate what they look like in youth and not too pulled. The procedure will be done under local anesthesia, as we talked about before. Will take about an hour and a half, and patient will go home this evening.